Ghani again from the UK. Thanks very much, Dr. Ghani.
Thank you. Dr. Mohammed Ghani, working in a district hospital, Eastbourne District Hospital. I worked as a specialty registrar. And just I'm going to present today, my case topic is a case study on liraglutide in an obese diabetic patient. That patient presented in our clinic. Yeah, can you move to the next slide? Yeah. So, yeah. So actually, as we know that diabetes mellitus is rapidly expanding to the whole world. And it estimated that in 2030, approximately 500 million people will live with diabetes across the world. Majority of them are type 2 diabetes mellitus. And in that diabetes mellitus, obesity most of the time coincide with them. And it leads to the increased insulin resistance, causing high blood pressure and also high blood lipids. So there is a pharmacological management should be aimed at promoting weight loss, or at least should be weight neutral. And so one of the major challenge for the diabetic patients in this kind of obese patient is the weight gain and hypoglycemia, which may delay the titration of their HbA1c target. Both insulin and sulfonylurea are proven medications which are beneficial for glycemic control, but there is always risk of weight gain and hypoglycemia. In that case, newer agents like glucagon-like peptide receptor antagonist, GLP, are increasingly being used. And there are various randomized trials which shows that if we can use that GLP-1 receptor agonist, it helps to reduce weight gain along with the better glycemic control. And there is a reduced chance of risk of hypoglycemia. Okay, in the next slide. Thank you. So our case report, the main aim was to find out how liraglutide effective in reducing patient body BMI, that is a weight reduction, along with is controlling an HbA1c. Can you move to the next slide? Okay, so we studied that retrospectively. Can we move to the next slide? Yeah. So this our lady, the case we studied, she was 56 years old female with known type 2 diabetic since 2003. And she is with us since 2014 in our clinic. So during her first clinic visit with us, she has a body weight around 104.9 with a BMI 40.7. Fasting glucose was reasonable, 8 to 9, and postprandial blood glucose was 11 to 13 in between this range, and HbA1c was 87 at that time. So during that time, she was on insulin Lantus 36 unit and gliclazide 40 milligram in the morning, around 20 in the evening, and using metformin also and simvastatin. So because of her body weight and her HbA uncontrolled diabetes mellitus, so after discussion with her, we started her on liraglutide. And during that time, she has no diabetic related complications. Can you move to the next one? So since then, we continued her on liraglutide, and it started to improve. It shows some improvement in her diabetic mellitus, improving her HbA1c. And she found that her body weight also gradually started to reduce. Like it came from 114 to 109 over last 4 years. And because her body weight is coming down, her HbA1c also controlling well. So we stopped her liraglutide at the end of 2018. And what we found that after stopping her liraglutide, her blood glucose started to rise again, and she started to gain weight. Although her other medications continued at the same time. And during that time, she continued to maintain her lifestyle and dietary modification. So after that, we discussed her case again in our diabetic multidisciplinary team meeting. We started her liraglutide again with 1.8 milligram in 2019. And since then, she able to maintain her good HbA1c and also started to lose weight, around 5% of her body weight. Can you move to the next slide? Yeah. So our findings was that since the starting her liraglutide, body weight around fall by 4% and her HbA1c reduced by 1%. And so after stopping in 2018, and she gained weight. And 2019, she restarted her liraglutide, and it reduced by HbA1c by 2%. And she managed to reduce her weight 5 kilograms, which we'll show later in the diagram. During the whole time period, she maintained her lifestyle interventions. Can we move to the next slide? So these are the just overall give a range how our CBG was when controlled, just little variations along with HbA1c, and overall her weight reductions from 114 to is coming to around below 100. She managed at the end of the 2019. Can I go to the next one? These are the list of medications. I'm not going through all of them. So there are quite a few changes. Initial our medications, like in 2018, which lent us change to levamir, stop liraglutide, start on empagliflozin, and in 2019 we started again on liraglutide and change her levamir to tojo. Okay, can you go to the next one? Yeah. So this is how her BMI reduced. We can clearly show that there are some ups and downs initially. And June 2018, just when we stopped the liraglutide, it came down to body weight she managed to reduce around below 40. And again, we restarted our liraglutide in October, which was significant drop in her her body weight, which is coming around below 38. Okay, can we move to the next one? So what we know that liraglutide is about, so main term discussion about the liraglutide is that it was first approved in 2010 as an adjuvant therapy to diet and exercise for management of type 2 diabetes mellitus. Also, according to the NICE guideline, it is still not recommended only solely for weight reduction. So it is a derivative of GLP-1, glucagon-like peptide 1, a polypeptide, incretin hormones secreted by the L cell of the GI tract. And it functions by stimulating glucose-dependent insulin secretion, it causes a decrease in plasma glucagon concentrations. It delayed gastric emptying, suppress appetite, and overall increase the heart rate. It is believed that the weight-lowering effect of GLP-1 RA is due to appetite suppression and delayed gastric emptying. It gives a feeling that stomach is full. And after administration, peak absorption occurs around 11 hours, and absolute bioavailability is 55%. Half-life is around 13 hours, allowing it once daily administration. It eliminates through liver and kidneys and doesn't interfere with cytochrome P450 system, which is a good side. Most common side effects are nausea, hypoglycemia, diarrhea, constipation, abdominal pain, and increased serum lipase. GI intolerance is the most common reason for discontinuation of the drugs in patients. There is also some correlations with acute pancreatitis, some serious hypoglycemic episode, tachycardia, and suicidal behavior. One thing is that liraglutide is contraindicated in pregnancy and should be avoided in nursing mothers, children, and coincides use with other GLP-1 agonists. There are quite a few randomized trials which conducted to evaluate the efficacy of liraglutide as a weight loss agent. 4 of these are part of the satiety and clinical adiposity, that is known as SCALE program. So during this trial, all participants were encouraged to continue their lifestyle modification. The result of the trial was satisfactory. It was found that mean weight loss was between 6 to 4.7% in comparison to placebo group 2%. Although in this trial, I think they focused morely on liraglutide administration to a higher dose, like 3 milligram. But in our case, we found that even using at a lower dose, she able to reduce her weight loss. So this is a good sign, obviously. Can you move to the next slide? So this is a conclusion that we reach the conclusion that liraglutide helps significantly reducing both body mass index along with our overall HbA1c level. But always we should emphasize that along with giving the medications, lifestyle intervention along with other diabetic medication is one of the most important things that we should always look for. So lifestyle intervention is the most important things to managing diabetic mellitus. Okay, that's all about my presentations. Thank you. Thank you very much. Is there any questions?